Good morning, everyone. My name is Patrick. I'm a student physical therapist. We're here today with my community partner, Brennan. How you doing today?
Doing good.
Awesome. This video, we're going to demonstrate how to perform a muscle test with the hand dynamometer right here. This hand dynamometer is going to help us quantify the patient's strength. Sometimes patients come into the clinic and it's really hard to quantify the strength that they have. So if we're able to put an objective number on it with the hand dynamometer, it's going to give us an idea of where the patient's at when they start and how they progress along the way as we continue to reassess the patient's strength. So first, we're going to be doing hip external rotation. Some of the smaller muscles in the hip. So Brennan, you okay if we assess some of the strengths in your hip today?
Yeah.
All right, we're going to be testing the right hip external rotators. So we're first going to take him through a fair test to assess his willingness to move. So go ahead and bring your heel towards me. There we go. So one thing we want to keep in mind, he's already kind of putting it into flexion. We just want true external rotation. There we go. Awesome. So that feel okay? So we know the patient's got a fair test. He can move in external rotation against gravity. So just opposite of the test that we just did in regards to a brake test, this is going to be a mate test. So, and to put that in layman terms, I'm going to be a movable wall, and you're going to do your best to try and move me, and that's going to give us a quantifiable number to how much force you're producing, okay? So I'm going to cue you on the count of 3. My resistance is going to, I want you to, my resistance is going to be an immovable wall. I don't want you to push too abrupt into me at first, get a feel for it, and then by you're going to push for 5 seconds, and by the 5th second we're giving maximal effort, okay? All right. So we're going to make sure that myself as the therapist is positioned in a mechanically advantaged position. So we're going to be just above the medial malleoli. And then we're going to make sure that that test can be repeated, because we're going to go ahead and do this 3 times an average, just to make sure that we're getting an accurate representation of the objective number that we are finding in the right hip external rotation strength. So similar to last video when we're doing manual muscle testing of the hip, we're going to want to make sure that you're in a stabilized position. Once again, I don't want you compensating too much. Don't bring your hip into flexion. We're just really staying true to external rotation. If you don't mind, I'm going to move your left hip out of the way just a little bit. I'm going to get myself in a mechanically advantaged position just above the medial malleoli. All right, and we're going to put the patient into mid-range just to make sure we're appropriately assessing the contractile tissues we're trying to. So I'm going to go ahead and bring you into a little bit of external rotation to help you get started. So on the count of 3, I want you to gradually push into me, but getting maximally by the 5th second. I'm going to hold and be an immovable object, okay? So 1, 2, 3, go, go, go. 1, 2, 3, 5, good job. Relax. All right. And the numbers will be computed on the handheld dynamometer. Once again, we're going to go ahead and assess that 3 times to get a good average number to make sure there weren't any outliers. Did you have any pain or anything like that?
Nope.
Feel okay? Mm-hmm. Awesome. Great job.